I'm Raina Stoicheva, the Director of Retirement Security Policy at the Harkin Institute. We timed this event to coincide with Medicare open enrollment from October 15th, which runs from October 15th to December 7th, when Medicare beneficiaries can make changes to Medicare Advantage and also Part D plans. This is the busiest period for SHIIP counselors who provide assistance to Medicare beneficiaries, and also coincides with a lot of activity on this topic. So we really appreciate that you have chosen to spend this 1 hour with our program. The Harkin Institute for Public Policy and Citizen Engagement was established to continue Senator Harkin's legacy on 4 key policy issues: labor and employment, people with disabilities, wellness and nutrition, and retirement security. Our goal is to improve policymaking by providing high-quality research and engaging citizens in public policy. We cannot do this work without the support of our donors and our audiences, of course, and our partnerships for different projects. Before we begin, we would like to acknowledge two important partnerships for this project that we are presenting today. The Harkin Institute is thankful for the partnership with the Iowa Insurance Division's Senior Health Insurance Information Program and Senior Medicare Patrol. Christine Griffith, the director of the SHIIP-SMP, was instrumental in planning and implementation of this study. She also provided feedback on the report and is a panelist today for us. We also appreciate the partnership with Iowa AARP. We worked with former State Director Brad Anderson and also State Advocacy Manager Paige Yance, and also National AARP. We worked with Terry Keenan, the Director of Health and Health Security Research, who provided funding for the qualitative interviews. Their support has been instrumental for this project as well. Our program will feature a presentation of the report, followed by a panel discussion, and then we will conclude with audience Q&A. Please submit your questions in the Q&A throughout the presentation, and we will try to respond to as many of them as possible after the panel discussion. To start us off today, Dr. Joshua Pearson will present the results from the qualitative study. Dr. Pearson is the program director of the Health and Healthcare Leadership Graduate Degree Program at Winona State University. He's an experienced leader and faculty in healthcare administration and is certified in healthcare quality and healthcare financial management. He's also a senior research fellow with the Harkin Institute. Josh, take it from here.
Thank you, Raina. Just wait for the slides to pull up here. All right, thank you very much. We can go ahead and go to the next slide as well. And Raina mentioned most of these. One I would just highlight here again, special thanks to Kristen Griffith as well as Dr. Rochelle Reimer, who were our peer reviewers for our policy report before publication. So special thanks to them for just reviewing everything and helping us get that document published. Just a quick background on Medicare. I know, as many of us know, Medicare is a very complex program, right? And it would be challenging to find another program that's changed more than Medicare in recent decade or so. We know Medicare Advantage penetration now represents over half of the market for eligible Medicare beneficiaries. Not to mention the growth of the Medicare Advantage plans available has more than doubled since 2018. And then for the specific special need plans, like dual eligible special needs plans, we've also seen fast growth in those over the past 5 years. And so what this leads to is an environment for newly eligible Medicare beneficiaries. There's a lot to navigate, a lot that they need to go through to make an enrollment decision during that initial period within a relatively short period of time. And so one of the resources we have to support that are the state health insurance assistance programs. They were created to provide advisory services and counseling and education support for individuals that are eligible for Medicare. But they've evolved a lot, and they do a lot of other things outside of that too. It's just something we really learned during our research here, that not only do they provide counseling and education and support, they also help educate on public benefit programs. They help resolve billing issues of Medicare. And many SHIP offices also have senior Medicare patrol services, which are really important for addressing Medicare fraud and abuse. And so they're very busy programs. And according to the Administration for Community Living, there's currently 54 SHIP grantees nationally that operate over 2,200 site locations with a network of roughly 12,500 individuals, a good portion of which are volunteers. So for this study, we partnered with the Iowa SHIIP office to conduct in-depth interviews with some of the volunteer counselors that are supporting Iowa SHIIP. So an Iowa SHIIP is one of the great SHIIP offices nationally. They have over 120 site locations across the state with a workforce of over 400 counselors that serve roughly 40,000 Medicare beneficiaries per year. And what we did is we worked with Iowa SHIIP to identify a set list of counseling sites. And from that, we were able to recruit 12 volunteer counselors to participate in our in-depth interviews. And you can see from the slide, we did our best to try to get a diverse representation, not just rural and urban locations, but also varying backgrounds in terms of their experience with SHIIP and also their professional backgrounds. So it's not all the counselors have a healthcare background. There's a variety of backgrounds individuals come to SHIIP with. And so there are 5 key finding areas we're going to talk about a little bit more over the next few slides. From our conversations with these counselors, these were the 5 areas that the conversation team seemed to gravitate towards the most. The first, centering around counselor training and their experience in managing the counseling workload that comes with being an Iowa SHIIP counselor. The second finding talked about the referrals that the SHIIP counselors receive from community partners and really just the valuable resource they provide in helping serve that need within their community. Challenges with dual eligible special needs plans in particular. So for those individuals that qualify for both Medicare and Medicaid, helping those beneficiaries navigate that and understand the program requirements. That was another big topic of discussion. And then unique challenges for 2 populations in particular. For low-income beneficiaries, which were categorized as those with incomes below 150% of the federal poverty level, and then also beneficiaries that would be considered English as a second language or limited English proficiency. Those were 2 specific populations we really centered our conversations on. And so first, focusing on the counselor training and experience with the workload that these counselors maintain. One of the things Ryan and I really learned from this is that you don't get to just volunteer to be a counselor and get to do it. There's actually a lot of work that goes into it and a lot of preparation that these individuals are doing as volunteers. During the initial period, there's training and online courses that they go through. Once they get through that, they shadow another individual that is providing SHIIP services. And then in that first year, they have a certain number of client contacts that they have to achieve. And so it's more than just volunteering because you're interested. It's a very big time commitment to be able to meet the requirements for being a volunteer. And a lot of our participants talked about that. And then not only that, but annual recertification every year after that. It's more training and education. It's a lot of work of staying on top of what's changing in the programs and what they're seeing in serving these beneficiaries. And then also their client contact requirements double after that initial year. And so again, a big commitment from these counselors. And that was one of the things that was really highlighted. And you can see 2 quotes on the slide. I won't read through the quotes, but we do have more quotes and more analysis within our policy report if you're interested in exploring that in greater depth. But the counselors really talked about, just staying on top of the information and the amount that you need to know to be able to support these beneficiaries, and not just foundational knowledge, but the specific things you don't see as frequently, but you still need to help them navigate for the different support programs that are available and the other questions that come up. It's a lot. And again, these are volunteers providing this service. And so it is a lot of work and effort. And that's something that was really highlighted through our research. The next finding area was for referrals. In talking with the counselors that participated in the study, they highlighted several different community partners that refer beneficiaries to them. Sources of these included healthcare providers and hospital systems, insurance agents, federal entities, and HR departments in the community. And there were a variety of reasons why they were being referred to SHIIP. Lack of in-house experience or knowledge on Medicare. We had some counselors say, they're going to their provider and saying, I don't know where I want to enroll, or I don't know how this decision is going to affect my ability to see you in network. And these providers would refer them to SHIIP to help answer those questions. Or some participants needed in-person one-on-one counseling that couldn't be provided at these other entities. And so SHIIP was seen as the partner for helping to make sure that that type of support was provided, which was really important for some of the more disadvantaged populations that we'll talk about here in a little bit. But then also for new retirees, HR departments, when people had questions about, I'm getting ready to retire and leave my private employer coverage to a Medicare plan, I don't know what that means, what that's going to do for my coverage and being able to see my provider I want to see. Those were things that, again, these HR departments were referring to SHIIP counselors, and they were trusted, reliable partners for those referrals to be able to meet that need. And so that really shone through in our research as well. For dual eligible special needs plans, again, this is for those individuals that qualify for both Medicare and Medicaid. Big discussion point was the knowledge gap that exists with that. Beneficiaries just really don't understand it unless they were a patient who was on Medicaid before or had familiarity with government programs. They really struggled with understanding what this was and even knowing what questions to ask to support that. So there was a lot of education that took place in just helping to build that foundational knowledge for those beneficiaries. They talked about flaws in the process or inefficiencies and how individuals transition from Medicaid to Medicare, right? Once you hit that age 65, the eligibility criteria change, and a lot of older adults struggle with understanding that, especially if that was something that they didn't see the communication sent to them in the mail or whatever methods, the Medicare handbooks and other things that they get to help support that transition. There's still a gap in understanding that and really just helping patients or beneficiaries navigate going from Medicaid to Medicare at age 65. And then COVID also posed unique challenges. It was interesting to hear from the counselors, particularly for beneficiaries that became Medicare eligible during COVID. Obviously, we had those waivers in place to help support continuous Medicaid enrollment, and then the process of unwinding started, and that's something that wasn't familiar to them, and they didn't understand what they needed to do to either maintain their coverage or if they were losing Medicaid eligibility to consider some of these other options that are available to them. And so COVID really threw a unique challenge into this conversation as well. Going on for those who are lower income beneficiaries, and again, this was those that were under 150% of the federal poverty level. Technology challenges was a big issue. It sounds like during COVID, there was a lot of movement to moving some of these processes and forms and things to an online format, which has some benefits, but also poses some challenges as well. Several of our participants talked about the fact that some older adults don't have access to computers. They don't have access to smartphones to complete these processes. And so they were quite literally going to a SHIIP counselor just to help them physically complete the steps that needed to be completed for their enrollment. And then for those that did have access to technology, of course, still the knowledge gap as well of understanding what they should be filling out, what type of information was needed to be able to complete the paperwork to get to enroll in Medicare. All these gaps that the SHIIP counselors were really needing to face just from the technology side of things. Physical and medical conditions were brought up. Individuals who maybe were hard of hearing and couldn't afford hearing aids, they can't have those conversations over the phone. They need to be in person with somebody having one-on-one conversations. And so SHIIP helped fill the gap with that, and counselors talked about their experience in working with individuals that had these conditions that made it relatively difficult to receive counseling services over the phone. Financial limitations were also brought up. Individuals who were having to make decisions based on what they could afford in the here and now versus what was in their long-term interest based on their projected medical needs. There were a few counselors that talked about trying to have those conversations with beneficiaries, and it was really limited to the fact that they were just trying to figure out what the cheapest option was because that's what they could afford in their budget right now. And some of the challenges that come with trying to, in a good faith effort, help the beneficiaries navigate Medicare enrollment with that in mind. Then, of course, those populations that are just making too much to qualify for assistance, but not quite enough to be able to afford what they needed outside of that. That was another population group that the counselors were really interested in sharing their experiences with. And then, of course, the last thing was social stigmas. A few counselors talked about how some beneficiaries didn't want to have conversations about support programs that are available because they were worried about the perception of that, and they didn't want to be someone that was receiving financial assistance from the government. And so just some of the challenges that came up in those conversations. And our last group, our last finding area was the unique challenges for English as a second language beneficiaries. Really in the conversations, it kind of fell into two buckets. We had conversations where the beneficiaries were relying on family and friends to provide translation or interpretation services for them, or others, if it was a SHIIP counselor that was working at a site that had qualified translators available, like at a hospital, for example, they talked about how their partnership with the hospital allowed them to have access to those translators. But for the vast majority of the conversations, it seems like a lot of times there's reliance on family and friends to provide those interpretation services. And as we know, there can be challenges to come with that, especially when navigating the complexities of Medicare and all the fun terminology that we get to interact with on a regular basis. And so gaps, another thing that really came up from our counselors was just talking about outreach and engagement with populations that had limited English proficiency, and just knowing that there were opportunities to strengthen that through a variety of different ideas. And they shared the recommendations with us in their policy report also that you can view. But really just trying to find ways, just knowing that there's a need and a gap to better support those beneficiaries. That was a really important conversation. And so within our report, we had 4 key recommendations. I'm not going to go into great depth with them because we're here to listen to the panel, not to listen to me talk through this. But our recommendations really centered around those 5 key finding areas. The first one really talked about the importance of having a formalized pipeline for connecting beneficiaries to SHIIP. And it seemed like through our conversations, a lot of it was just kind of someone referring them to SHIIP, and it was on the beneficiary's obligation to reach out to SHIIP to close out that referral. And so really just exploring options for how to strengthen those referrals to where they become less informal and more of a structured formal process. For the second recommendation, focused on those dual eligible special needs plans in particular, and not just those, but the other special needs plans that are available as well. Just enhancing education and support for helping beneficiaries better understand what those programs are and what the eligibility criteria are, and how they can go about being considered for that. Sounds like counselors are doing a lot of the legwork on that on an individual basis in those meetings with beneficiaries. And so how can we provide better information and support to those beneficiaries so they better understand those programs when it comes time to make an enrollment decision. The third recommendation centered around financial planning and planning for retirement. Several counselors also talked about some of the struggles beneficiaries would have with understanding what their assets were and understanding the other financial implications that come with retirement, not just Medicare enrollment. And we know all that ties in together. We can't look at those as isolated, siloed topics. We need to consider it as a whole comprehensive body of requirements for retirement. And so just providing better resources and support to help beneficiaries understand just those basic financial planning concepts, to understand how enrollment is going to affect their financial security in retirement. And then lastly, strengthening community partnerships. Again, close those language gaps, strengthen the outreach and engagement with English as a second language population, and be able to provide better support in those areas that were perceived as a gap by our counselors that participated in our study. And that is it for my talking, Rhina. I will send it back to you.
Thank you, Josh. The only thing that I will add, this was a great overview. And again, the report is available on the Harkin Institute website under Retirement Security Policy. And while you're there, please check out all the other policy areas and the great things that the Institute is doing. But the only thing that I did want to add, Josh and I both listened to all the 12 interviews. It's just really our sincere appreciation for the dedication and the service that is provided by the SHIIP volunteer counselors. Everybody in these interviews expressed really genuine concern for the welfare of Medicare beneficiaries. Their concern because we focused on these vulnerable populations, right? The challenges that they could see and their willingness to look at opportunities to make things better for them, and just their true commitment to the program. Very positive, very supportive of the mission of the SHIIP program. So again, our appreciation to these hundreds of volunteers who provide these services annually to Medicare beneficiaries in Iowa and obviously across the nation as well. Before we start with the panel discussion, I will just very briefly introduce the rest of our panelists. You can find their full bios on the event webpage. Already briefly mentioned in the acknowledgements in the beginning, Christine Griffith joined the Iowa Insurance Division's Senior Health Insurance Information Program and Senior Medicare Patrol in February 2020, just before the pandemic. So she had to deal with all of the challenges that Josh mentioned, some of it of providing these services remotely, virtually. These federally funded programs provide counseling, education, and casework assistance to over 48,000 Iowa Medicare beneficiaries annually. And as we mentioned, there are over 120 sponsor sites hosting almost 400 volunteer counselors. Paige Youns is the State Advocacy Manager for AARP Iowa. As a former nursing home and assisted living administrator, Paige understands firsthand what it takes to serve seniors in a complex regulatory environment. This experience, coupled with her lifelong passion for seniors, makes her an excellent advocate for older Iowans. And then to provide a national perspective, we have two speakers who are affiliated with national organizations. So Brandy Bauer joined the Northeast Iowa Area Agency on Aging in August 2024 as the Joint Center Director of the State Health Insurance Assistance Program, so SHIIP Technical Assistance Center, and Senior Medicare Patrol Resource Center. Prior to this position, she spent over a decade at the National Council on Aging, including as Director of the Medicare Improvements for Patients and Providers Act, or MIPA, Resource Center. She has extensive knowledge about Medicare enrollment and public benefits, including Medicare subsidies for low-income older adults and persons living with disabilities. And last but not least, Rachel Gershon joined Justice in Aging in 2003. Her work on the health team is focused on improving the experiences of low-income adults enrolled in Medicare, including paying for medications, leaving incarceration, and navigating both Medicaid and Medicare at the same time. So as you will see, this is a really well-rounded panel. We'll dig a little bit more into the Iowa experience, but also get a national perspective. We appreciate all of our panelists. Thank you all for joining us today. And I will start us off with the first question, sort of organized along our findings from the report. The first question is directed to Brandy. If you could give us a more national perspective on how the Iowa results about recruitment, training, the counseling workload compared to other state experiences from your perspective at the National TA Center.
Yes, thank you. You know, the thing that I will say is Iowa is sort of a microcosm of the national landscape. There was nothing that was sort of revealed in this research that surprised me, because pretty much every state in the country has some of the same challenges that the Iowa SHIIP program has experienced. You know, just to highlight a few things that Josh pointed out, for example, Medicare has become more and more complex. There's the availability of many, many more private Medicare Advantage plans and D-SNP plans, and that makes the work of counselors just that more difficult. You know, coupled with that is this digital divide, not only for the beneficiaries who may lack access to technology or experience using technology, but also for the counselors themselves. More Medicare services are being driven online in terms of enrollment and helping people to navigate the plan finder. And that's very challenging for a counselor who may be coming into this and unfamiliar with technology. And then the last thing I would point out is simply that, you know, there's, you know, 63 million people on Medicare nationally. And you know, as they're covering more complex issues, the SHIIPs nationally has remained relatively stagnant. So they're doing what they're doing. Impressive that we're able to even, you know, staff 120 sites in Iowa and to still continue to recruit volunteers. It continues to be a challenge.
Yeah, thank you, Brandy. I do want to stay a little bit on this point, because this was the feedback that we also got from Kristen, and I kind of want to pass it on to Kristen a little bit here. And just to put this in context again, in terms of the changing workload over the changes in Medicare, and we'll also segue then into the second discussion question. But yeah, Kristen, just a little bit more about the workload versus the funding, and and those challenges that you brought up when we sent you the report the first time.
Yeah. I think Brandy kind of hit the nail on the head, is that, you know, the population is expanding, Medicare numbers are going up, Medicare is becoming more and more complex, so we've got more people to assist with more complex issues, and the resources involved to make that happen aren't changing. And so that's pretty significant. You mentioned earlier that the volunteers do amazing work, and it never ceases to amaze me how much our volunteers are getting done. And again, I want to stress, volunteers providing complex counseling services on one of the most confusing topics out there. So they're doing amazing work. I mean, we couldn't ask for better volunteers. And I just want to highlight that, especially right now during OEP, when we've got volunteers that may be putting in, you know, 40, even 40 plus hours a week providing counseling to folks during this open enrollment period, which is going to be from October 15th through December 7th, when everybody who's on Medicare should be reviewing the Medicare Advantage plan, their Medicare drug plan, to make sure it's still fit for the next year, because those plans change year after year. So, I mean, and that may be the start of some of the complexity. Plans are renegotiated every year. They change every year. And I think especially on the Medicare Advantage front, what we see is an increasing number of options available. I think in Iowa right now, this year for 2025, we're going to be up to 76 different Medicare Advantage plans. And it's not only that you have 76 plans, but it's also the kind of bigger and different range of supplemental benefits that all of those plans make available too. So somebody coming in to sit down with a counselor to talk about what they, you know, what they might want to enroll in for 2025, if they're looking at an MA plan, we get feedback all the time from counselors saying, I don't know how to do this in an hour. I don't know how to do this in one session. When, you know, they want to understand the dental, the vision, all of the odds and ends on that. And then I think it's even more complex too with some of the changes we're seeing, not only in Iowa, but also in other states, around provider networks changing, right? And provider networks leaving Medicare Advantage plans. Some of this can be happening mid-year, some of it might be happening at the end of the year. But it's also, how do you make sure the folks that are coming to you understand you have to reach out to each and every person you get healthcare from, you know, whether it's a specialist, a general practitioner, whether it's somebody that provides your durable medical equipment. You need to make sure those people are all in network of any plan you want to go into. And then I think, to add a little bit more interest, if that's not already complex enough, you know, some of the changes that are going into effect with the Inflation Reduction Act, you've got all this happening around taking a Medicare Advantage plan. You've got a lot of changes with plans that are available, that aren't available, provider networks. And now a lot of people have questions around the $2,000 cap. How does that work? Or the Medicare prescription payment plan. What is that going to do to my out-of-pocket prescriptions? So I think it's kind of a perfect storm of these changes happening within the plans, the availability of what's there growing, and then additional changes happening to Medicare at the structural level, a lot of which I think are really positive for Medicare beneficiaries, but still require time and effort and energy to explain so people know exactly what they are and how they work.
Yeah, thanks, Chris. I think that's a great segue to kind of the next part of our questions here. So obviously, you know, Medicare is changing a lot. It's not just Medicare Advantage, but Kristen touched on some of the other things with Part B and prescription drug plans, and, you know, out-of-pocket caps and changes to special needs plans. And so it'd be really interesting to hear from Rachel and Paige, just from the Justice and AD perspective and AARP, what are some of the main things that your organizations are really focused on right now in terms of how it impacts Medicare beneficiaries? And then maybe Kristen and Brandy could talk about those items and how that impacts the volunteers right now. What are they hearing from volunteers in terms of the questions or the pain points that they're seeing with those changes?
Yeah, I can go first real quick. You know, one of the things that we hear time and time again from members is that it's just really hard to filter through all of the different sources of information and really understand what's what. I mean, you and I are inundated with media, with stuff coming from friends, videos, photos, whatever it may be, articles that appear to be very legitimate but might have some misinformation in them. So something we're hearing from our members a lot is that they really appreciate that AARP tries to streamline resources and give them a one-stop shop for links to things that they can trust and verify. Obviously, we are not a direct service provider when it comes to this, but we coordinate really well with Iowa SHIIP-SMP. We do a teletown hall with them every year. And there's always great questions on there about the ins and outs of things that are specific to Iowa that maybe don't have a national angle. But I think that's what we hear the most, is that it's just hard to filter through all of the noise and really understand where should I be getting my nuts and bolts information if they're not already exposed to the SHIIP-SMP program, because not everybody is. And for the people who do know about it, that's where we continue to filter them to. But for every person who knows, there's a handful that don't. So making sure that they have a trusted resource in AARP to guide them there.
So, and I will echo Paige, we hear a variety of issues, from how do I initially enroll in Medicare? How do I avoid late enrollment penalties? What happens if I'm on both Medicaid and Medicare? How do I understand what's covered, which provider to go to, how to make sure that I'm not billed? And then when it comes to plans, do I have to join a plan? No, on the Medicare side, you do not. What's the benefit of joining the plan? What should I look out for when I'm looking at a plan? For example, provider networks, we know to advise folks to call and make sure, and not just rely on provider directories. All of these questions have really big stakes. You know, if you get them wrong, you can get stuck in a place where you're paying more out of pocket than you should be, or not able to access care quickly. And there are also questions that are not something that you can just ask a friend who has a similar situation, or read enough regulations to understand what's going on. Sometimes the answer to that question is really only from a trusted, unbiased provider. And Justice and Aging, we have relied, and our network has relied on the SHIIP network so profoundly over the years, because we're so lucky to have them as a trusted, individualized, one-on-one resource. And I think the fact that not enough Medicare beneficiaries know that SHIIPs are available is a big issue. And if all those Medicare beneficiaries were to understand that resource available to them, we would have a major crisis, and capacity is also an issue. If you look, for example, at the funding levels for exchanges, for Marketplace, which is a tiny part of the healthcare market in the United States, it dwarfs funding for SHIIPs, which is, 15, I think, % of the United States population. So thinking through, how can we right size the support that we're giving for this valuable resource so it can continue and do good work, as Medicare has so many questions of such high stakes for folks.
That was perfect, Rachel. Actually, both as a segue to the next question, but also to bring back the 2 points that we are sort of balancing in our report is, all of these services are great. These people are motivated. They provide high quality advice. This is the best resource. We encourage you to go there. And yet then we also have these constraints. But my next question actually deals with how we make sure that more people know about that SHIIP exists and how to connect with them. And it's centered around that finding of referral pipelines. What are some current initiatives to facilitate this, both in Iowa and nationally? And maybe start with Kristen first, since she mentioned this in her feedback to us, and then we'll take it to Brandy and Rachel.
Yeah, and I think we've had some discussions about this, because my head sometimes wants to explode when we start talking about things like referral pipelines, because I kind of feel like we're balanced on the very fine line of asking way too much out of the volunteers we already have. So creating additional pipelines to bring more clients into a system that I feel is at capacity makes me very anxious, as it would any volunteers, any SHIIP counselors that are listening to this right now. But I think over the years, we've done a few things. We've tried to figure out, how do we work efficiently with systems that already exist. A couple of years ago, we actually moved SHIIP sites. We had done a lot at libraries and community centers and senior centers. And one of the things we intentionally did was move more into hospitals and clinics. And we did that with the thought that there is an existing pipeline of internal referrals that can happen, because a hospital wants to make sure that folks know that they can afford their meds, that they're in the plan that's going to meet their needs and help them cover their costs. And also, we found that hospitals and clinics tend to have more resources when it comes to volunteer management, because we work in partnership with the sites where we house SHIIP-SMP volunteers. You know, they are providing basically the day-to-day volunteer management. We're providing kind of the database, subject matter expertise, but we need both of those pieces there for it to work. So that's been something that we've actually been pretty intentional about. We've also been doing some outreach and trying to create some systems recently where we can make information available to HR folks at employers. We know that they don't want to be answering questions about Medicare. So we've put some tools out, and we've been sending out emails to some of these channels through, there's SHIIP, which is the Association of HR Managers in Iowa, getting information out through those channels to make sure that they can provide their employees with basic information so they can make educated decisions about when they enroll into Medicare. And we're also doing a little bit with Spanish-speaking populations. I might hold that until later because I think we're going to get into that population a little bit more. I mean, I totally agree. There's so much more we could be doing. And I think we're just constantly trying to figure out how do we balance that with the capacity that we have.
Yeah, I would add to that some of the best referral pipeline is the people who receive services from SHIIPs are often the ones who refer their friends to the SHIIP. And then those people get so excited, they want to actually volunteer for a SHIIP. And so, that word of mouth and that little community activation goes a long way in promoting our services nationally.
This takes me back to the early 2000s. I actually was SHIIP trained and was helping some SHIIP volunteers, and they mostly came from the base of people who were receiving help and said, hey, this is a great way at the time to learn how to use a computer and to be a professional in retirement. I think it is a great position for a lot of folks who are not quite ready to completely leave professional life behind as they retire and look for other opportunities. In terms of referral pipeline, I really agree with Kristen. I think there is an understood reluctance for a large scale campaign sometimes because we know about the capacity issues. But I do really appreciate that SHIIP counselors are listed in the Medicare and You publication, which I recommend for anyone. It's one of the best consumer facing resources in healthcare anywhere to help you understand what your benefits are and basic answers to questions. And Medicare and You also can refer you to your local SHIIP network. Looking towards the future as capacity grows, I would love to see more connections between Medicaid programs and SHIIPs, both to help build the Medicare capacity within the Medicaid administration and to understand when it's appropriate to refer back and forth when folks have questions.
Perfect. Thank you, Rachel. I'll actually stick with you for this next question as well. One of the things our counselors really highlighted were special needs plans and dual eligible special needs plans in particular. And so I know this is an area Justice and Aging is very active in. You have many great resources out there in this space. And so just curious to hear your thoughts on what are some of the best practices you can highlight from Justice and Aging's work, and not just making sure people understand what these plans are, but then that they're actually accessing and enrolling in these plans when they're eligible.
Absolutely, absolutely. I think I touched on this a little bit before. Earlier this year, we wrote up something called a DSNP FAQ, and we really wrote it with the understanding of like, if somebody is in front of you asking, should I join a DSNP? What should I look for? Here are the questions to ask. So it goes through issues around, I want to stick with my provider. How do I make sure that my provider is available? How do I access the provider directory? What other, how do I call and ask? It goes through medications. So a DSNP is a dual eligible special needs plan. It's only available to people who are dually enrolled in both Medicaid and Medicare. In terms of medications, you have to be super careful. Especially this year, we're seeing a lot of variation in what medications are covered from one year to the next. So check your formula, like check your list of medications in the Medicare Plan Finder. I'm very aware that it's open enrollment right now. And that's especially important in Medicaid. Often when you have Medicaid and Medicare, once your Medicare benefits run out, your Medicaid takes over. For medications, it's a little more limited, so it's especially important to check your list of medications that it's covered. And other things to consider is just in terms of, are you expecting to use a lot of healthcare in the next year? What is that company's reputation in terms of doing prior authorization and other things that might make it administratively challenging to be in healthcare? What supplemental benefits are they offering? And how is that eligibility for supplemental benefits limited? Would you fit into that category of being able to receive? It's always an option to stay in traditional Medicare and fee-for-service Medicare. There are trade-offs, whichever choice a person makes. But it's also important to understand that if you're in traditional Medicare and in full Medicaid, often what you would have received in supplemental benefits is provided by the Medicaid agency. So there's options between the different coverages to think about.
Yeah, thank you for that. For the sake of time, I'll move us to the next question here quickly. And this one's for everyone, because I think there's value in both the state level and the national perspective on this. But another issue that was really highlighted in our report was the need for better engaging diverse populations in the community. And counselors shared a lot of ideas for this. One of them was even recruiting a more diverse volunteer workforce. And so just really interested to hear from the full panel on what are some strategies you've seen in your work, either at the state level or nationally, that can really help address this need to better improve outreach and engagement for diverse populations? And I guess we can start with Kristen first at the state, and then we'll go.
Yeah. And this is actually something we've been focusing on, I guess I would say the last 2 years. We were lucky enough to receive some additional funding from ACL, which is also where the SHIP funding comes through. As part of the public health emergency funds that allowed us to hire a consultant to work with us to kind of map out across the state pockets. And we wanted to specifically focus on Spanish speaking communities, Spanish speaking folks, because that is the, after English, second most popular language. And so what we did was kind of map out, okay, which counties, which areas in the state have pockets of folks that speak Spanish. And then within that, let's look at community organizations that are serving folks. Let's look at media outlets that are working with them, if there are churches or other places of worship. And so we've mapped that out. And what we've been trying to do is kind of build relationships with these entities to look at how we can better serve that population, because I think historically we have underserved folks that are Spanish speaking in the state of Iowa. So trying to figure out what we need to do. I think one of the initial findings we had that we probably weren't quite as aware of as we should have been was just how a lot of times how little understanding there is of Medicare as a whole and how it works and what it does. So it's not even that you're starting talking about SHIP and the great services we provide. It's that you're starting out by talking about Medicare and who's eligible and how does it work and what does it provide. And then you're starting to talk about SHIP and services that we have. So we've been doing some outreach through online Spanish speaking publications to our first article was, let's talk about Medicare and how it works and what it is, how it's different from Medicaid. And then we're going to talk about the different pieces of Medicare. So we're trying to do public education that kind of builds that base of knowledge. And then we're also trying to figure out, I think Brandy talked about it earlier, that, some of your best counselors are folks that received services already. And if we're not serving that population, we don't necessarily have that pipeline to pull from. So that's one of the reasons we're also trying to do a better job of working with organizations that are serving folks that are Spanish speaking, so that we can, create those connections. And can we provide service through that entity? Can we kind of benefit from the community relations that they already have set up? And then we're also just trying to think about what table should we be at. We were at the Latino Cultural Heritage Festival, I guess a month ago. We had a booth there. Certain partnership tables we want to be at. So I do think it's a process of very intentionally kind of building that credibility, letting folks know how Medicare is, who you are, what you do, and then moving from there. But it's going to take us a while.
I would add to that thinking outside of the box of just healthcare and finding those cultural associations, those local, societies and employers that have, inroads to the population that you're trying to serve is very helpful. I think another thing to really think about is the caregiver population, because, there's a huge number of people who reach out to SHIIPs who are trying to help their parents or, grandparents navigate Medicare. And we often focus on recruiting and training folks in this sort of Medicare population itself, but there's a lot of caregivers out there who are slightly younger generations who I think would benefit from learning about the services, and then also maybe interested in volunteering their time for some of that assistance.
I just want to give a quick shout out to the federal government here, to the Centers for Medicare and Medicaid. They've really made a huge effort in recent years. Medicare and You this year is being translated into 4 additional languages. And they are also requiring plans to translate documents and provide interpreters for many languages starting this year, really focused state by state. So the most languages spoken in Iowa, for example, not just nationwide. So those are some really positive changes that we're seeing.
Yeah, I would add, Rachel, across AARP, obviously we engage in all 50 states, but in Iowa specifically, people forget that there are a lot of other languages that are spoken here. And so sometimes I think, especially in the Midwest, it's easy to forget that. And so we do try to have a lot of resources online that are translated into multiple languages. Frankly, we don't have as many in print just because it's not as requested as often. But online, we do really try to have a strong presence in a lot of different languages and for people from a lot of different backgrounds too, because I think that's the other thing to consider, is that education level also plays a role in your ability to understand some of this content. And I think we can all agree that even as people who work in this industry, there are things that we read and we're like, I don't understand what that says. And if we can't understand it, how can we expect the general public to understand it? So I think that's the other consideration, is how are we taking the content that we hear and translating it into something that's a little bit more digestible too.
Thank you all. This is again, great points. A couple of things that I would like to circle back before we move to our next question. And I did see that Rachel answered one of our audience questions, but also to point out that online, you can go to Medicare.gov as well, right? And the Medicare Plan Finder is one of the online sources. And then the Medicare and You is that like more of a pamphlet, shorter sort of guide?
Oh, sure. It's not short. It's about 150 pages long, but
Okay.
it's really well done, plain language. If you want to know if podiatry is covered by Medicare, you can look it up in the index and it'll tell you. I love it. It's a pamphlet about what is owed to you, basically, if you are enrolled in Medicare. What are your benefits? What can you get? And how can you enroll? And then Medicare Plan Finder, you enter your zip code, and if you want, you can enter your list of medications, and that'll help you decide between Medicare Advantage plans if you decide to go into managed care.
Well, and I was just going to add something. We just put a resource on our website about 2 weeks ago, which is SHIIP with 2 I's, SHIIP.iowa.gov. Under the resources tab, there is Medicare Open Enrollment, and we've got a link on there to a really nice video from CMS, from Medicare, the Centers for Medicare and Medicaid Services, that actually talks about how to use the Plan Finder. It's pretty well done, and then we've also got a little tip sheet that we've put on there. So if you are using Plan Finder to run your own drug plan or Medicare Advantage plan comparison, it gives you some things to watch out for when you're doing that.
Perfect. Thank you, Kristen. And there is a question, actually, I'm going to toggle back and forth between this, and we have one last panel question, but I think we're good on time. How can you get a hard copy of the Medicare and You 2025 if you are looking for one? Is that something that you can request from the local SHIIP office?
The local SHIPs are going to have a limited copies, but anybody can call 1-800-MEDICARE or go online to medicare.gov and request that a physical copy be sent to them.
Perfect. Thank you, Brandy. Perfect. So I did want to, that's really great information. Thank you so much. The two things that I wanted to circle back to, great point about also focusing on caregivers. And in fact, a couple of the counselors that we interviewed became SHIIP counselors because they were caregivers and they were trying to navigate this for their parents. So again, I just wanted to emphasize that this is an important group, not only necessarily those who are approaching retirement. And the other one about translating in different languages, we also were funded. Part of this discussion has been going on now since early this year, and the symposium had a panel again on Medicare. And the summary report that we produced was funded to provide a translation in Spanish and Arabic. So these are the two most spoken languages in the Des Moines metro area. But there, yes, we are also looking, and there are some resources and funders who are willing to support this kind of work. So just emphasizing that that's an important initiative in reaching out to these groups. And so these two would be available also on our website from the event. So the last discussion question that we had prepared for the panel centered around this concept of financial planning and managing your healthcare expenditures. And we really had a very lengthy discussion in the symposium panel about this. Some of you were on that panel again. And so one of the really big barriers that was identified by the counselors in the interviews was just the constraint, the requirement that people have to collect information that proves what kinds of assets and income they have before they can verify that they're eligible for additional support and subsidies through Medicare. And so many people simply do not know this, right? And so the administrative burden, both on the programs that are administering these kinds of supports and also on the SHIIP counselors who are trying to provide help with this, can be lessened by strategies to streamline benefits. Some states have streamlined what are the requirements for different programs. So if you qualify for Medicaid or SNAP, then you qualify, for example, for low-income subsidy and the Medicare supplemental payment for the drug benefit, right? So is both from a state perspective, but also national perspective, what is some low-hanging fruit in this space? Like, what are some easy things that we can do that would really sort of take away that from the workload of counselors and program managers? Anyone, maybe? I don't know, Rachel.
Oh, sure. So there is a new regulation out. It was finalized last fall. It's called the Medicare Savings Program Streamlining Rule, and it can be very helpful. It's a helpful roadmap for how policy can move towards better streamlining in terms of being able to access assistance for paying for Medicare costs. So to back up a little bit, Medicare can be very costly in terms of premiums, in terms of out-of-pocket costs when you're on Medicare, and there are programs that can help, including things called Medicare Savings Programs. I think in Iowa, is it called QIMBY? Is it Qualified Medicare Beneficiary? Sometimes it's a different name. Okay, great. Qualified Medicare Beneficiary is one of the most generous. You can be on full Medicaid and on Qualified Medicare Beneficiary to help you pay for your premiums and cost sharing. it varies from state to state what you have to have in terms of what you show in your savings account or other assets. And there's new rules out to help states figure out how to make what's required in terms of what's in savings and how you have to prove what you have in assets. I think one of the things that gets really wonky, but often people get have a hard time is if they have a life insurance policy, trying to prove that that's not over an asset limit. Often we see people nowhere near the limit of what you need in a life insurance policy, but it's really hard to get the exact number to show you're under the limit if you have one. And that rule has some changes that will help people show that their assets aren't over a certain limit.
Yeah, and the federal government lets states have a lot of flexibility with how they implement these programs, the Medicare savings programs. There are, I think it's 13 states now that have just completely eliminated asset tests. So as long as somebody has a low income, they can qualify for QIMBY. That's obviously not a short quick solution, but it is something that folks in Iowa could really advocate at the state level. It helps to reduce a lot of the administration of that program for the state. And then it helps to make sure a lot of those people who have very limited income are able to get help from those programs.
Well, and we've started quarterly kind of maybe strategic issue isn't the right word, but thinking about kind of bigger picture issues with our Iowa HHS counterparts. And I know that one of the things they're looking at is how do these changes that Rachel talked about impact enrollment for Iowans. And so they're looking at that. And I think we've got our next call we scheduled for beginning of December to kind of talk through that a little bit more so that we can understand as those changes happen, you know, how do we continue that partnership and making sure that we're aware of folks that may have changing status, because I think especially if somebody is losing Medicaid, if somebody is becoming eligible for low-income subsidy, there are points where if we can provide services to them at that time, we're going to make sure that they're in the right plan. We're going to help them save money, you know, answer some of those complicated questions about providers. It's just a great time to figure out better partnership around those points so we can make sure we're providing services then.
Perfect, thank you. I'll take, oh, sorry.
No, just right now is a great time to check your coverage. It's also in terms of managed care, also a great time to just check and see if you're eligible for one of those Medicare savings programs, eligible for Medicaid. There's been a lot of changes in recent years, and some people may have lost eligibility even though they're technically still eligible. So it's absolutely okay to check again, try again for different programs, including low-income subsidy, Medicaid, and Medicare savings program.
Perfect. Yeah, thank you for this, Rachel. I think we can take a couple of questions because they look like quick questions to me. As a community health worker who often refers patients to SHIIP, are there available materials that we can provide before their visit with SHIIP so that prepares them to ask the right questions?
Yeah, I would say definitely. If you go to our website, again, SHIIP with 2 I's, SHIIP.iowa.gov. We've got a number of resources available there under the resource tab. There's a great brochure for somebody who's getting ready to retire. There's a booklet that helps them answer some critical questions if they're looking at Medicare Advantage plans. And the other thing I would say is you can always reach out to us. Our toll-free number is 1-800-351-4664, and we'd be happy to also mail out hard copy documents if you'd like to keep a stack in your office. I know a lot of folks appreciate also having something in hand if they're not eligible to get computer or internet access.
Great, thank you, Kristen. This might be a little bit bigger question, so let's see if we can do a quick take on this one. It came early on, and in terms of how we manage and help people. There is the Medicaid enrollment broker model. Is anyone familiar with how this works? And do you think that can be replicated? These are usually contracts with nonprofits who have no direct or they have very indirect financial relationships with health insurance. So they help Medicaid beneficiaries choose among managed care plans. Is that possible to be a source also for Medicare? If
So that's
anyone
a
has,
little, sorry, that's a little similar to how SHIIP works right now.
Okay.
Where the federal government funds states and states can subcontract to nonprofits. They can also administer the program themselves. And I will just say, yes, let's use that model to get more funding into the SHIIP network to match what we're seeing in Medicaid and Marketplace to match the need.
yes, and that's a great note to end on. Thank you so much for your participation today and for sharing all your expertise. You can please follow all of our speakers, follow their websites because they have great information on this topic. And thank you for joining us today. And we look forward to seeing you in other programs in the future. Have a good day. Bye, everyone.